Okay, today we're going to do Chapter 13, which is Human Relations and Communications. Our presentation topics are going to be personal service in the contemporary pharmacy, characteristics of pharmacy technician, other aspects of professionalism, and Health Insurance Portability and Accountability Act, also known as HIPAA. So I'm going to just skip through these learning objectives because you can read over those prior to starting the recording. Okay, so first we're going to talk about personal service in the contemporary pharmacy. So the pharmacy profession, of course, has undergone some changes throughout the years. So the emphasis now is going to be on the patient. So in other words, it's going to be more patient-oriented pharmacy. So in the contemporary pharmacy, the pharmacist is going to be more than just a dispenser of drugs. Okay, so the pharmacist is going to have what they refer to as a more clinical role. They're going to focus more on counseling the patients, of course, on new medications, also identifying drug interactions, and also they're going to concentrate on making recommendations on over-the-counter medicines or diet supplements for patients as well. So the pharmacy technician is more than just a cash register operator and a salesperson. So what the pharmacy technician is going to do, they're going to assist the pharmacist in actually the filling process of the medication. So a new and welcomed emphasis on personal service, of course, has returned to the practice of pharmacy. So personal service in the contemporary pharmacy continues. So personal attention, uh, which, if you think about it, is a courtesy of tone of voice, a smile, eye contact, a listening ear, assisting customers in finding merchandise. Okay, so that's what personal attention is to the customer. So what that does, it makes the customers feel that the pharmacy is a pleasant place to do business. So it is going to be important to get to know your patients, and a lot of the pharmacy uh, want you to call them, of course, by their first name as well. So um, as you get to know them. So usually, when someone's picking up a medication and you don't know them, then of course you would say, "Thank you, Mr. Hall. Come back soon." But after if he's been in there several times, he may feel comfortable you calling him. Say if his name was Dan Hall. So next time you could say, "Thank you, Dan, for come back and see us," or But if you think about it, when you go into a place of business and you're going into, there's two pharmacies. One pharmacy you go into, they're not mean or rude, but they just, they take your prescription, they fill it, and they give it back to you. Okay. No, thank you. They're not rude, but they just, they don't overly do that personal attention. But if you go into another pharmacy and you have the personal attention where they're calling you by name, they're smiling and they're going, "Well, thank you. I appreciate your business." That makes you want to, as a customer, to go back to that pharmacy when you get personal attention. So first, pharmacy technicians, of course, should remember the primary rule of merchandising. At all times, you are representing your company to the patient or customer. Remember that in pharmacy, you are, in a legal sense, an agent of your employer and entering into a contract to provide care to the patient. Your employer must answer for all of your actions. Okay, so just remember, and I always tell people all the time as well, when you're a pharmacy technician, you should treat that job as if it was your personal pharmacy, because you want those customers to keep going back. If you want to keep your job, you need to make sure that you represent yourself as if it was your place, because you want to provide care to the patients. You want the patients coming in. When a pharmacy's patients start going somewhere else, what they do in pharmacy is the number of pharmacy technicians that they have there is how many prescriptions they do. So the more patients you get coming in, the more hours you'll get as pharmacy technicians, as a whole group, you'll get to work. So if you have a slow, you start losing patients coming into that pharmacy, what will happen is the company will come down, they'll cut your number of technician hours that you can have technicians there working. So you want to be nice to those customers and you want them to keep coming to your pharmacy instead of somewhere else. Especially if you want to keep your job or the amount of hours that you're working. So that's another thing to remember. So, question here is, of course, here are some questions to think about, of course, while you're studying. So, how have the roles of pharmacist and pharmacy technician changed? And just think about what we just talked about with the patient-oriented pharmacy. So, and of course, why is personnel service important in today's pharmacy? So, characteristics of the pharmacy technicians. A successful pharmacy technician must possess a wide range of skills, knowledge, and aptitudes. So, along with these, the pharmacy technician must also display a professional attitude, communication skills, and problem solving skills. Okay, so the pharmacy technician, of course, must have high ethical standards. So, what that means is you need to have an eagerness to learn. Pharmacy technician job, it's not one of these jobs that you're going to go in and you're going to know everything. All those, there's so many drugs out there available. They're always changing. Some change their formulas. Some you get new drugs that'll come into the pharmacy. So you always got to learn. So just have an eagerness to learn. Um, then you need a sense of responsibility towards the patients and towards other healthcare workers as well. So even working in community pharmacy, you need, of course, to have that nice attitude or professional attitude towards the patients because you want to obviously you want to keep them coming back because them coming back means secures your job, and you also want to be nice and have a professional attitude towards other healthcare workers. Even though if you work in a community pharmacy, you're still going to have contact by insurance companies. You're going to be talking to nurses and doctors on the phone. So you need to always make sure that you have a good professional attitude and know how to communicate well with others. You need to have a willingness to follow instructions. Um, your pharmacy will have a certain way they want things done. If you feel it could be done better another way, it may be something that you could mention to the pharmacist. If he says, no, I want it done this way, then you need to have that willingness to follow their instructions and not do it your way. And sometimes that's hard sometimes because, um, the company wants you to do it one way, and then, there might be other ways you could do it at a little bit better um, pace or, better way. So they usually have a reason why they want you to do it and follow their instructions. An eye for detail. So you need to make sure that, in work, under stressful, hectic situations. So you need to be able to multitask. So you need to be able to multitask and then have an eye for detail. So when you're multitasking, you need to be able to stop, look over the details, and then make sure that you're not making any mistakes. You need basic knowledge in basic math. If you notice in the pharmacy calculations book, we are going over a lot of specific math. That specific math is needed to pass the national test. Now, if you want to take the state test, it doesn't have as much math in it. So I kind of want to make sure that you're aware of that. But we do, our course here at WCC, we do teach you to pass both the national and the state test. And of course, have good research skills. At times, a patient may ask some detailed questions on, can I order this? If you don't have it in your pharmacy, you may need to be able to research it and find it in different places where you can order. Or if you can't find it, you may research like Walmart or other pharmacies that may have it there as well. So as long as you take care of the customer, they'll still keep coming back, even if you have to get Walmart or another company to order it for you, for the patient to pick it up there. So sometimes that, is still, the patients will still keep coming back. I know when I worked in retail pharmacy, I worked for CVS, and we had good relationships with, like Pulaski Pharmacy, because I worked in Pulaski, Walmart, and we would always, if we could order something for them, for one of their patients, we would do that and send it over there to them, and then they would do the same for us. So we kind of helped each other out. So attitude, this is just an outline of what we're going to go over on the characteristics. Attitude, verbal and nonverbal communication, and problem solving. Of course, attitude is very important in customer relations. We've already talked about that a little bit. The pharmacy technician should maintain a positive attitude even when the day is hectic or when he or she is not feeling up to par. So it is hard at sometimes to go into, especially retail, when you're working in any type of retail atmosphere, not even just pharmacy. You're dealing with customers. So it is very, very important to have a positive attitude and a smile on your face, because your day will be very hectic. But I always felt it to be relieving when someone would come in and I could get away from the filling process and talk to the customers and show a good attitude, and knowing that they walked away happy made my day a little bit better. So just always try to keep that positive attitude. And a definition, of course, of attitude um, is the emotional stance and disposition that a worker adopts toward his or her job duties, customers, employer, and coworkers. So a positive attitude also means taking pride in your workplace. Um, so you need to be able to keep it looking nice and neat. Make sure that you get the work done that's meant to be done. The pharmacy technician, of course, should offer feedback on improving pharmacy operations. Just like I said before, your company may have a certain set of guidelines and instructions on what they want you to do. But if there is a way to improve pharmacy operations, you do want to offer suggestions, but you want to do it in a nice, professional way. Not that my way is better. So you want to offer suggestions, of course, to the supervising pharmacist or store manager, of course, on the ways to improve to improve the operation and to serve customers better. Anything that's going to improve customer service, you should offer your suggestions. But you do not want to criticize management, and you do not want to criticize the way they do things already. Okay, but what you want to do is just offer well thought out constructive solutions. Okay, so being an invaluable asset to the overall operation can often be helpful in career advancement. So you always want to display a professional in appearance as well. So customers expect a high degree of cleanliness and professionalism. So the following, of course, are the important to conveying a professional atmosphere. And that's going to be proper attire. So every pharmacy is going to be different in what they're going to require you to wear or allow you to wear. Of course, retail pharmacy usually wants men dressed in dress pants and like a buttoned-up shirt, sometimes even a tie. Some may be more relaxed and let you wear polo shirts for the men. Women usually, nice casual dress pants and a nice shirt or sweater. And usually they have to wear a certain type of lab coat. Usually that lab coat is going to be ordered from the pharmacy because they're going to have specific ones they want you to wear and they want everybody to match. Okay, so like I said, every pharmacy will have their own dress code. Make sure you follow it to the T. Do not try to say, well, this, kind of skew off from that, because it will make management upset and mad if you're not following their proper attire. So the pharmacy technicians, of course, must always wear a clean lab coat and name tag at all times. That's very important. You know the customers by name because you're getting their name and information, and it is important that they know your name as well. Okay. Grooming, of course, you always want your hair and makeup should be clean and neatly fixed. Okay, so I know sometimes the style would be, some people will have like piercings other than the ear on their face, like on their nose or something like that. Most pharmacies will not allow that because a big part of, especially retail pharmacy, is you have a lot of older people that come into the pharmacy. So you want to be what I call conservative. So usually the grooming is going to be conservative hair, which is also clean and neatly fixed. Makeup should be neatly fixed, not too dark, not too much there as well. Okay. And of course, personal hygiene should be kept clean as well. So appearance, of course, the overall outlook, of course, of your appearance of an employee on the job is including your dress and your grooming. A pharmacy technician, of course, must be observant of the customer's needs. Okay, so with many things happening at once, it is often necessary to try what they call customer needs. So what that means is a good employee, what you would need to do is continually scan the areas around him or her looking for customers who need help. A lot of times customers are very hesitant about asking for help, but if you see someone that keeps kind of looking around in one area, that's pretty obvious they're looking for something specific but cannot find it. So to show good customer service for a pharmacy technician would be to go out there and ask them if they need help finding a certain product. If they have questions about that certain product, of course, you would need to refer them to the pharmacist if it is not something you can just read off of the bottle itself. You also want to acknowledge customers with "I'll be right with you" and "thank you for waiting." So sometimes customers will come up to the window and you'll be in the middle of doing something and they're like, "Ma'am, can you help me find such and such?" Or they may have a question about such and such. Just say, "Oh, sure, give me just 1 minute," or "I'll be right with you as soon as I get done with this one thing," and then finish what you're doing. And as soon as you finish that one little thing, go ahead and ask the customer. Okay, sorry about that. I had an interruption in my PowerPoint. So what you want to do next is, once you get done with that specific task that you're working on, is you want to immediately go to that customer and say, "Okay, now I can help you. What can I help you with?" Okay. So, and then, or say, "Thank you for waiting while I finish that. What can I help you with now?" So it is very important to make sure that you acknowledge them if you can't get to them right away. Okay. A lot of times when I walk into a pharmacy, if I sit there and wait and I wait and I wait and no one even says, "I'll be with you in just a moment," or I kind of get a little frustrated because if they acknowledge, "I'll be right with you, just a second, okay," or anything like that, or "I'll be right with you," I'm a lot more patient waiting if at least they've acknowledged me and that I know that they know I'm there waiting. Okay, because I have a lot of common sense. I know people are busy, but just acknowledging makes that much better. Okay. So in a community pharmacy, of course, there can be a lot of things going on at one time, such as the phone ringing, patients waiting to pick up orders, or drop off prescriptions, and etc. So it is very important to acknowledge, of course, that acknowledge the customers if you can't get to them right away. So TRIAG is the assessment of the pharmacist of an illness or symptom. Outcome may be to recommend an OTC product or refer the patient to a physician or emergency room as well. Um, it is important to demonstrate professional empathy for the patient. So patients may be experienced in any number of difficult situations. Such as, and I'll give you some examples of some different or difficult situations that they may be encountering. It could be something like losing a loved one, or a loved one has become very ill with cancer or something very badly, or the patient may have been recently diagnosed with a series of illnesses. They may not, be feeling very well. Also, a lot of times a patient has waited at a doctor's office for 2 or 3 hours, and then they have to come and wait again in the pharmacy. So they're experiencing a lot of different situations or difficult situations. So a caring attitude, of course, can go a long way. So the pharmacy technician, of course, is often the bearer of bad news. So it is important to take the time to explain why a prescription could not be filled or why insurance does not cover a particular medication. Okay, so if a patient comes in, they drop off a medication, and they're sitting there waiting and waiting and waiting, and you're having trouble with it going through the insurance, call that patient over there and let them know. Say, "Miss Arnold, we're having problems with your medication going through your insurance company." And she's like, "Well, I don't understand. My insurance should pay for that." Or say, just to let them know, if you don't know right away, so "I don't know right away, but I'm getting ready to call them." And so it is important that in a retail pharmacy that you call the insurance company for that patient and you find out why it is not being covered at that particular moment. Sometimes it could be that just needs 2 more days, to be refilled. They have certain amounts of time. If it's a 30-day medication and they're trying to fill it on day 25, but they should have already 5 more days left. Some insurance companies are very, very picky, and they may say, "Well, they can't get it filled for 2 more days." So in 2 more days, it may go through on their insurance. So you need to be able to find out, and that's just one example. But you need to be able to find out why that particular medication is not being um, covered by the insurance company, and let that patient know. Um, if you just send it over there and they go to pick it up and it's $100 and they're like, well, my insurance is supposed to be paying for it, and you didn't, as pharmacy technician, didn't do your job on trying to find out why before they get to that point, it makes it worse for the patient. They get a little bit more frustrated. So if you're doing data entry and insurance billing, it is important for you to, if insurance rejects it, that you call the insurance and find out why it is not being covered at that particular moment. Okay. So it is important, of course, to know your pharmacy. So the pharmacy technician should be on the lookout for customers who look confused or are trying to find a particular product. The pharmacy technician can look for customers' requests, so handling those pertaining to product location, availability, and price. So a pharmacy technician can pretty much saying a pharmacy technician may handle any type of situation where they're just trying to find a product location for a customer, the availability, can we order it or not, and they'll give them the price of it. Okay. Also, referring to the pharmacist, those that require professional judgment. So anything that's going to require professional judgment is going to be things like the patient may say, "Can I take aspirin or ibuprofen with my blood pressure medicine?" Okay, that needs a professional judgment. So the pharmacist would be the one that they would need to speak with. But you would actually need to walk the patient over there to the pharmacist or tell the pharmacist this customer has a question about this, and then the pharmacist will usually go right to them and let them know. Okay. So anything, in other words, if a patient wants to know if they can take something with like blood pressure medicine or cholesterol medicine or something like that, that would need the professional judgment of the pharmacist. If they're wanting to know if it would interact with another OTC medication, it would also need a professional judgment as well. So making a personal connection with customers is very important, especially in a community pharmacy. I don't know about you guys, but when I go into a pharmacy and I get that personal connection and a nice attitude, I'm definitely more willing to keep going back to the same pharmacy. So greeting customers by name makes a big difference. Patients are going to be more likely to return to a pharmacy where they have received personal attention than to one where they have not. And that is true to me as well. Uh, Eye contact is especially important to older customers who may rely on informal lip reading to compensate for a hearing deficiency. You will see this a lot of times in older patients. Also, older generations of Americans often associate eye contact with honesty, sincerity, and respect. Okay. A pharmacy technician needs good communication skills when receiving prescriptions and assisting customers. Um, Verbal, of course, communication skills require practice, especially in pronouncing medication terms or medical terms and drug names, of course, which over time it'll come with practice. Okay, they are still some words or some drug names that are difficult for me to say, and I have to stop and think about it before I say it. So they are some that are very difficult to say. So don't feel bad. That comes with practice and how you pronounce those. Asking patients open-ended questions, such as opposed to closed-ended questions, is always more helpful in eliciting information. So an open-ended question is going to require a specific answer and not just a yes or no. Okay. Um, so it requires a yes or no answer. So and then a closed-ended question is going to require a yes or no answer. So an example question for that is, do you have a headache? That would be yes or no. An open-ended question example would be, it's going to require more descriptive answers. So an example of that would be, please describe your headache pain for me. So you're actually requiring them to be specific. Uh, nonverbal and verbal communication. Nonverbal communication, of course, is going to be very important also. So it is easy to understand and need to only pay attention to the other party to interpret what is being conveyed. So if you look at these next few things, facial expressions, eye contact, body position, and tone of voice, these are all methods of communicating, of course, without using words. The mood of the person can often be determined through nonverbal communication. So that's where it is a good attitude. Facial expressions, having a smile on your face at all times. If you look, even though you're not mad, and you have a serious look on your face. A lot of people, customers, their first reaction is to think that you're not happy. You're not being very nice. Eye contact, like we said earlier, is very respectful to a lot of people. Body position, and of course a nice tone of voice. If you're frustrated, it will tell in your tone of voice. So always try to make sure that you concentrate on making sure your tone of voice is nice sounding. Also, as well too, and sometimes in retail pharmacy, you will get customers to come in and complain. If they do, you should always never interrupt, even if it's something that the pharmacist wants to handle. Always let that customer completely finish fussing or saying what they want to say. Okay, never interrupt, because it's rude and it causes them to get more defensive. So if you just let them finish, just stand there and let them finish telling you what they're telling you. And if it's something that you want, the pharmacist requires you to refer them to them. Once the customer gets done complaining or saying what they want to say, then you say, okay, well, I understand. Let me let you speak with the pharmacist. Okay. Also on page 393, there's some examples of your poor and better nonverbal communication skills. It might be important to look over those as well. Nonverbal communication, of course, is communication without words through facial expressions, body contact, body position, and tone of voice. Listening is a vital skill for the pharmacy technician. Just like I said earlier, um, maintain eye contact with the speaker. Use nonverbal signals to indicate that you are genuinely interested in what he or she is saying. Ask questions to clarify what has been said. This confirms that you have correctly heard what was said by the patient, and it also lets the patient know that you were listening. Repeat key points to the conversation to confirm that you have correctly understood what has been said. So always use a non-judgmental expression and tone of voice. Never let the patient feel that he or she is imposing or that your time is more valuable than theirs. And just remember, all patient medication information is confidential and protected by law. So using, of course, courteous speech. When interacting in person with customers, I always use courteous words and phrases such as good afternoon, have a nice day, please, thank you, may I help you. Okay, thank you for being patient. So when talking on the phone with other healthcare professionals as well, you want to also use the same courteous words and phrases as well. Be sensitive, of course, to age or gender, cultural and language differences. Okay, so become familiar with the cultural backgrounds of your customers. So with language, so you may have a customer comes in that speaks Spanish. It does not speak English very well. So you want to make sure that you become familiar with their cultural backgrounds of your customers. So some computer softwares nowadays will translate you can type the instructions out in English, then hit a button, and on the bottle it will put it in their language. So if you work in a pharmacy that does that, that is a nice thing to do for people who or do not speak English very well. Gender, just to kind of be an example of being sensitive to gender. One example is sometimes female patients may only feel comfortable talking to female pharmacists about like certain products, like feminine products, or female related problems that they may be experiencing. So you shouldn't take it personal if you're a male and they don't want to talk to you. It's just that they feel more comfortable talking to a female. Vice versa with the males. Sometimes a male customer may come in and have a male problem and they will want to talk to a male pharmacist rather than a female. So you will be able to better serve your customers. So knowing certain things such as sign language or a different language is always a plus in working in a retail pharmacy. So make sure that you add that to your resume if you speak another language, and that could be sign language, Spanish. Um, from Blacksburg, I worked at Blacksburg for a while, and you have many people, different languages that come in there, speak different languages. So that is very important to put that on your resume, and uh, and the pharmacist will look at that as well. So that's a plus. Be understanding when obtaining information from customers with mental and physical disabilities. So you do not want to use medical jargon. Of course, that may confuse the patient. You want to use layman terms. Many patients also may not have the prescription drug coverage for many reasons, such as they may be unemployed, or they're only employed part-time without benefits, or they may be unable to pay for a high cost of insurance. So it is important that for the pharmacy that if you notice that, offer them some lower cost alternatives such as generic or store brand products, or by calling the doctor's office to find an alternative lower cost prescription. Provide information on free clinics or community health centers if possible in your area, and do not treat those without insurance different from those other customers. And a lot of times in the pharmacy, retail pharmacy especially, you will get coupons from the drug representatives that come in, and anytime they have a medication that you have a free coupon with or a reduced price coupon, it is important to make sure that you share that with the customer and give them the option of using it. We will stop here on part 1, and I'll record the rest of this chapter in a separate video.